Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Are you suffering from sadness or emptiness? Do you have lost interest in activities? Do you feel changes in appetite and sleep? Are you feeling fatigue and low energy? Do you find difficulty in concentrating on any topic, on any subject? Do you feel guilt or worthlessness? Do you become irritable or restless at times? And do you are having headache, aches and pains in the body? If yes, you may be suffering from a depression. In today's vlogs, we are going to discuss what's depression, what are its causes, how we can diagnose, and how we can treat someone with depression. So be with me. Let's see if these symptoms of yours or any of your colleagues, your friends, your relatives is indicating that he or she is having depression. As I mentioned in the intro, if someone is having sadness or emptiness, someone has loss of interest in activities, as mentioned in the intro, we are going to discuss depression in today's vlog. What is depression? We doctors define depression as a mood disorder characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities. I repeat, depression is a mood disorder characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities. Depression has got different types. One type is major depressive disorder. Second type is persistent depressive disorder or dysthymia. Third type is postpartum depression. In ladies who have given birth to the infant and just after that they become depressed. Then there is another type, and that is seasonal affective disorder. And the fifth is bipolar disorder, manic-depressive disorder. So disorder may be of any type, but the most common types are these 5 types. So if someone is depressed, he or she may be feeling sadness, emptiness, loss of interest in activities, changes in appetite and sleep, fatigue, low energy, difficulty in concentrating, feeling of guilt or worthlessness, irritability, restlessness, and physical symptoms like aches and pains and headaches. Why people becomes depressed? What are the causes and risk factors for depression? There are many, and they include genetic predisposition, impaired or disturbed brain chemistry, life experiences, medical conditions like thyroid disorders, substance abuse, family history of depression, social isolation, and major life changes. All these contribute towards depression, and a person becomes depressed. How we doctors diagnose that someone is having depression? There are different tools. These include comprehensive diagnostic evaluation, psychological assessment, medical history and physical examination to exclude other causes resulting in depression, and of course, applying diagnostic criteria DSM-5 or ICD-11. And once someone is diagnosed with depression, then we offer them drugs like antidepressants, mood stabilizers, and antipsychotics. We also offer them psychotherapy, which includes cognitive behavior therapy, interpersonal therapy, and psychodynamic. And of course, the lifestyle changes have got a very important and pivotal role in the treatment of depression. And these lifestyle changes include exercise, mindfulness, sleep hygiene, and social support. And remember, there may be alternative therapies. These include light therapy, and of course, some herbal supplements may be offered to these people. So, if you or your relative or your colleague, your friends are suffering from symptoms suggestive of depression, and this is important that you seek the medical advice so your proper evaluation is done. Any contributing factors towards your depression, if it is, they are found, and attempt is made to treat your depression with drugs and related therapies. So, dear colleagues, I end here, and in the coming vlog, we shall take another mental psychiatric disorder and discuss that in detail. Till then, take care. Khuda Hafiz.